Madam President, I come to the floor today because this week President Obama is going to present his new jobs plan to the American people, to all of us. And I am certain that we will hear a lot of talk and a lot of promises. Now, I remember when former House Speaker Nancy Pelosi famously announced in 2010 at our White House health care summit. I sat around the table at that summit, and in the discussion, she said that the president's new health care law, she said, would create 4 million jobs. 4 million jobs. And here's exactly what former Speaker Pelosi promised on February 25th of 2010. She said, quote, "This bill is not only about the health security of America," she went on to say, "it's about jobs." She said, "In its life, it will create 4 million jobs, 400,000 jobs," she said, almost immediately. Madam President, I ask today, where are the jobs? The fact is that the president's health care law didn't create jobs. As a physician, I've come to the floor every week since the health care law has been signed and have given a doctor's second opinion about this health care law and why I believe it's bad for patients, bad for providers, the nurses and the doctors who take care of those patients, and terrible for the taxpayers. So here we are 17 months after the president signed his health care plan into law, and the American people have yet to see job growth anywhere near the figures promised by Nancy Pelosi. In fact, the Bureau of Labor Statistics reported last week that the American economy generated a whopping 0 jobs during the month of August. 0. This is sobering news when we have 9.1% unemployment in America. The New York Times, September 3rd, had an editorial called "The Jobs Crisis." And let me read from it. It says that the August employment report released on Friday, this is the New York Times, is saying, is bleak on all counts. It said, but at least it leaves no doubt that the United States is in the grip of a severe and worsening job crisis. Severe and worsening. It said this should lend a sense of urgency to the speech on jobs that President Obama plans to deliver this week. And of course, the speech is scheduled for tomorrow night. The New York Times goes on to say the economy added no jobs in August, 0. And the anemic numbers for June and July were revised downward, Madam President. The unemployment rate is stuck at 9.1%, and then it goes on to say it would be 16.2% if it included the swelling ranks of those who find only part-time work and the millions who have given up looking for jobs that simply do not exist. So, here we are, Madam President, looking at this sobering news, and it seems like the only connection between the health care law and the jobs market in America is that the job creators, the people that create jobs in this country, made it very clear that they can't afford the president's new health care law. Month after month, we hear from more people in the private sector who explain that they'll either have to fire people or stop providing coverage in order to comply with the significant expenses of the new health care law. Let me repeat, this law encourages job creators not to create jobs, but to fire workers, not to hire workers. Well, to get around this problem in the short term, the administration began doing something that I didn't anticipate when the health care law was signed. They began to grant waivers from the president's health care law. They said, oh, it doesn't apply to you, doesn't apply to you, come and apply for a waiver. Well, during the month of August, this past month, the administration once again granted another round of waivers from the president's health care law. Another 73 waivers allowing another 105,000 people to get out of the mandates of the Obama health care law. Since October of 2010, the Obama administration has granted over 1,500 annual benefit limit waivers. Now they're granting them for 3 years. And these waivers now cover over 3.4 million Americans, so the law and the mandates don't have to apply to them with regard to the benefits. Now, over 50% of these waivers, who have they gone to? Well, they've gone to union people, people who've gotten their health care through a union health plan. These are the very same people who lobbied for and supported the president's health care law. It's startling that even unions can't afford the president's law. Remember Nancy Pelosi saying, first we have to pass it before you get to find out what's in it? Well, as more and more Americans have found out what's in the health care law, they say, we don't want this to apply to us. In fact, the Service Employees International Union said that the law would be financially impossible for them to comply with. Well, I don't think any job creator or American family should have to bear financially impossible costs because of the president's health care law. Each time this administration releases yet another round of its health care law waivers, it reminds the American people how fatally flawed the president's new law is. Now, as the president prepares for his speech tomorrow night, he needs to take a hard look at his health care law. He needs to face the unfortunate reality that his law actually makes it harder and more expensive for the job creators of this country to hire more people. We need to make it easier and cheaper for the job creators of this country to create private sector jobs. But yet the president's health care law makes it harder and more expensive. Tomorrow night, the president needs to change direction. Instead of giving waivers to businesses and unions, he should announce that all Americans can get a waiver from his health care law. Now, the good news is that I have a bill that he can support immediately. My bill will allow any individual, any American citizen, to submit a waiver application seeking relief from any or all of the health care law's mandates. Waivers will be granted to individuals showing that the health care law is either increasing their health care premiums or decreasing their access to benefits. The bill is simple, it's straightforward. It's Senate Bill 1395. It's called the WAVE Act, and there are 16 co-sponsors in the Senate. Basically says if your costs go up or your benefits go down, then you have the freedom to get out of the president's health care law. Health insurance premiums have risen 19% since President Obama took office. Tomorrow night, the president should announce that he will allow all Americans an opportunity to opt out of his health care law. If he did, this would be one of the best steps that he could take to help America's economy. And that, Madam President, is why I come to the floor week after week with a doctor's second opinion about a health care law that I believe is hurting our country. Thank you, Madam President. I yield the floor and suggest the absence of a quorum.